thank you so much for joining us in our second podcast interview. So, just before we get started, I just for any new viewers who are on our YouTube channel and starting to watch this video, we just want to give a quick overview. So, obviously, you can tell from our channel, it's called My Career Talks. So we're just exploring a podcast platform for, communicating a community of practice for innovation and improvement. And not only that, we're trying to dissect an interviewee's current career journey. By that, I mean from their career aspirations to their education history, current work experiences, and any motivations and setbacks they may have had in their career journey. So with that in mind, we have our second interviewee on the call. Her name is Danielle Rawls. So hi, Danielle. How's it going? Thank you so much for joining us.
Going well. Thank you for having me.
Yeah, and then we also have our buddy of mine, Inder Mir. Hi, Inder. How's it going?
Pretty good. Just excited to know the story of the second person that we're interviewing, Danielle. So yeah, looking forward to it.
Yeah, I'm also excited as well. So with that in mind, we can get started. So Inder, would you like to start?
Yeah, Danielle, do you want to introduce yourself and tell our viewers and us, you, Mir and me, what exactly you're doing currently right now, professionally?
Sure. So thank you very much. So as Mir mentioned, my name is Danielle Rawls, and I'm the Quality Improvement and Knowledge Translation Facilitator at the Scarborough Center for Healthy Communities. And so my role, first kind of to tackle the first part of my title, so the quality improvement piece, is to assist the various managers at our community health center, which includes both clinical teams and non-clinical teams. So those that support social services like clothing banks, food banks, housing, those kinds of things, with their quality improvement initiatives. And so I guess for those who maybe are unfamiliar with quality improvement, basically my job is to troubleshoot. So in the most simplest of terms, I work with the managers of those various teams, and if they have a particular issue that comes to mind, so for instance, maybe no-shows at some of our clinic appointments, then I would work with the manager and the team, because it's really important to get a whole host of people involved in projects like these to better the outcomes for our patients. So how do we, in my example that I just used, like no-shows, how do we improve that rate so that we not only see more patients, but also figure out the reasons why there might be an issue. So that's kind of my quality improvement piece. And then my knowledge translation piece is slightly different. So it kind of comes at a variety of angles, but one of the items that I'm most currently working on is our community health center is transitioning to a new electronic medical record, PSS. And so I help a lot with kind of developing capacity within the teams, and then also helping people understand how to take this really technical knowledge and apply it to their everyday work. So that's kind of the knowledge translation piece.
Okay. So what I'm thinking is from the perspective of someone who's in high school, for example, how would you break it down? Like, when you said like building capacity, so a person in high school might not know what exactly that means, not because they don't have the brain capacity, but because they really need to understand what are the terminologies that are used. So if you want to break it down for someone who's in high school, how would you break it down?
Absolutely. So basically, I help people to understand and apply different learnings to their work so that they can do it themselves. It's like kind of a frequent saying is like you teach a person to fish, you don't fish for them. So basically I would work alongside that person. So if they were saying, how do I chart? How do I do this in this new system? I would walk them through how to do it with them doing it themselves. So I'm kind of like a tutor, if you could think about it like that. And actually that was previously what I did in high school, so and in university too. So maybe that comes a little bit more naturally, but that's what you're doing. You're kind of assisting them along their journey and not just giving them the answer per se.
So that would be the knowledge translation piece, right?
Yes.
Okay, so now maybe we can go to the quality improvement aspect of it.
Absolutely. So for the quality improvement piece, it's more troubleshooting, really, and working with the team to figure out why an issue is happening. So for instance, if you think about, I'll give another example, but for instance, maybe scheduling issues, maybe secretaries or somebody identifies like it takes way too long for us to book appointments with our clients, then I would dive in with that team and say, kind of a strategy that we use is the 5 whys. So why is it taking so long to book? Well, the system's really hard to manage. Why is the system hard to manage? Because it's not built for us. Why is it not built for us? So we keep asking why to find the root of the problem. So again, you could kind of simplify that back to if somebody was in high school, right? If you're not understanding a math problem, why don't I understand it? Well, I didn't understand the first concept. Well, why didn't I understand the first concept? Because you know what, my multiplication skills are really poor. Why are my multiplication skills are poor? Because I haven't spent the time to learn it, or I need someone to show me a better way. So that's kind of the way I would think about it.
Yeah. So as the saying goes, the quality of your questions determine the quality of your life. So yeah. So quality of your work as well. Amazing. Cool. Yeah, that answered my questions.
Awesome.
Do you have something that you're thinking, Mir?
Yeah, so Danielle, you just briefly elaborated more on, well, I guess there are two roles into one, like the quality improvement and knowledge translation. So my question was, do you, so suppose an individual who is trying to get into this particular type of role in both quality improvement and knowledge translation, what skills did you feel that you needed to have before attaining this role? Because, you know, I can see that within these two, I guess, roles in terms of quality improvement and knowledge translation, some of the skills can be overlapped, or some skills might be, you know, similar that you need to have before attaining this position or this role. So if you were to give an advice to, you know, to an undergrad or to a high school student, what would you say in terms of the key skills that would be required for these two roles?
So I guess I would probably say one of the major skills, and I know this might shock a lot of people because it's not going to come from a degree or a class, but it's trust. You have to build trust with the people you're working with in a role like this. Specifically when you're working with teams and projects, if they don't trust that what you're trying to do is trying to actually benefit their daily work, they're not going to be invested in it. If you are trying to help them learn a new system or learn a new way of doing something, they've got to trust that you have their back and you're going to support them. That, you know, when you're done your work with them, that if they have a question outside of that kind of period that you're really assisting them, that you're still going to be there to assist them. Whether you actually do anything above and beyond is beyond the point. It's the comfort and the trust they have that you will be there if they need you. So I would say that's like a number one soft skill. And then a technical skill, I guess that I would say, is not being afraid to ask questions and not being afraid to truly tell people, like, I don't know, I will find the answer and let you know. To be open to asking questions and consistently asking those questions, either to the people that you're working with or to the people that will help you help the people you're working with.
Okay.
So would you say those are the skills that kind of like helped you transition from job to job, as in like, I've seen your LinkedIn, so I'm just thinking about that, as in like, were those skills, did they stay with you and their value kept on increasing, or the technical skills? What's your perspective or your take on it?
So I would say like the first real career, I would say, position that I had outside of my university career was as a health planner at one of the local health units in Ontario. And that position I was working with many different teams across the organization, as well as the role that I'm in now. And that was the first time that I felt like question asking helped me immensely, because at that point I was kind of fresh out of university, and I was, I had my ideas of what I thought I knew, but was working with people from health inspectors to people who were doing prenatal classes. So it was varied in scope. And so I had to ask those questions so that I understood where people were coming from and what aspects that I didn't understand myself that I needed to then learn. So I completely agree. That was my stepping stone. And then I was able to ask those questions more and more. I would say different parts of my career, it's been more of a challenge to ask those questions in certain aspects. So there's always going to be people that you feel more comfortable asking those questions to, and always people that you're going to feel a little bit more nervous to. In my second kind of major position, I would say, was when I was working at Vancouver General Hospital as their injury prevention lead within their trauma services department. And so I worked a lot, not only with the Vancouver public health system, but also with the trauma surgeons on the team. And to ask some of those trauma surgeons who are super smart, and they were lovely people, super approachable, but to ask those questions was a little bit more frightening, because I wanted them to feel like I knew what I meant. But at the same time, you have to not be afraid to ask those questions. And in turn, that builds trust. So when people feel like you're genuine, and it kind of builds that level of trust. So I feel like those two are really interconnected.
Mm-hmm. Do you mind I ask another one, Mir? I just have a bunch of things coming up.
Yeah, no worries. So Danielle, just to, I guess, dive in, I know that you, a few seconds ago, you mentioned about, I guess, your first official experience, I would say, in healthcare, based on your LinkedIn as a health planner. So I know, well, based on what you just said, you were interacting with a lot of, I guess, stakeholders within that organization. So in terms of, I guess, in terms of that position, were you just gathering, I guess, answers to certain projects, or were you just responsible for improving processes as well? So like, what was your main role, or I guess list of responsibilities as a health planner?
That's a great question. So the health planner role is kind of unique, I would think, in the public health scope of work. I have met only a couple in my time working, but I really enjoyed that contract position for a couple of reasons. And so the overall scope of that job, to answer your direct question, was to support the teams in any program planning that they were doing. So for instance, I'm thinking of a specific one that's a bit more sensitive, but like opioid crisis. That was a big, major area of focus in many public health units. And so one of our roles, was to support building a program plan for that. So gathering data, helping the health promoters or public health nurses or whoever was doing kind of that kind of deep dive into the data and the history and the literature, assisting them with how to find that information that they needed. Whether that was me searching the data myself and at StatsCan or pulling reports, whether that was helping them do a literature review, whether that was helping them organize the information that they had, helping to determine what staff we had that we could put towards a program. One particular public health nurse and I worked on a falls prevention program for elderly seniors. So looking at all of the amazing different health promotion programs that they have for falls prevention, because there's a ton, and synthesizing down to what was our main focus area and what was our main group that we wanted to target, what program would be the best for them, and then how do we roll that out. So that was part of my role. And then part of my role was kind of quality improvement-esque, but like one of the projects that I was involved with was streamlining our intake process for public health inspectors. So when somebody calls and says, I have a raccoon that has rabies, that's bit my dog, what do I do? And then having a public health inspector come out to that and stuff, how does that process work? So I was also involved in that to help kind of make that process more efficient. And basically quality improvement is not only kind of troubleshooting, but also making things more efficient in the long term.
That's great.
So what I was thinking while all different answers that you've given about different roles that you've had, I want to understand, did you had a particular direction in mind, or like when you were, say, getting out of high school and then going to university, did you know what target you were hitting, or were you like, we'll see as we go? And depending on that answer, you could probably kind of like highlight for someone who potentially might want to follow your path, or has general direction about their potential career choices, but how would that person navigate that? So maybe if you could highlight that could be very useful for someone.
Absolutely. Okay, so you're gonna probably both laugh because when I was in high school, I really, 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 really badly wanted to be a cardiac surgeon. And so that was my goal. I was going to do it. And then so I went to Queen's for my undergrad in biology, and I was excited about it. And as I started taking courses in university, I decided that there was a different way that I wanted to go. I didn't want to be the end woman anymore. I didn't want to be the person that, you have a coronary artery disease, you've got to go in for cardiac surgery and be the surgeon that fixes you at the end. I wanted be the person that stopped you from getting coronary artery disease so that you didn't have to get to the surgeon. Mm-hmm. And so I explored, I'd always had a passion for health, and that was evident in anything that I did. My dad was a paramedic. My mom was in the health system as well. So kind of familial tendencies there too. But as I started to take different health courses in university, whether it be nutrition, whether it be health policy, I loved health policy. I still like policy. I know that's super strange, but I do like
policy too.
Yeah. I realized there was so many things that I could do to prevent that. And I guess probably the biggest piece of advice that I would give is don't limit yourself in your university career, even if you think, health is kind of my pathway. Take that random course, maybe even if it's in health. I'm thinking for myself, it was probably health geography, which was just an interesting piece.
I've never heard of that course.
It was awesome. I really enjoyed it. And it just opened your eyes to a breadth and different scope of work and interest. And so part of my degree, because I did a specialization in environmental biology, was that I got to do a research project, which was essentially a mini master's thesis in my fourth year, which was crucial to my master's work. And that was basically, I worked with one of the professors to kind of build this. And I realized I really liked that public health, kind of preventative health piece. And that's just solidified it for me. And I was like, I'm doing my master's in public health and health systems, and I want to work in the systems level of healthcare. So that's how it happened for me.
Okay, that's a great explanation, because you covered a few terminologies there which someone who's in first year, second year, or high school might be getting familiar with, but might not necessarily understand how it fits into the structure of the whole healthcare system. So that's a great answer. Thank you so much for that.
You're welcome.
Yeah. So Danielle, thank you so much for elaborating on that. So the other question I had was, since I guess from seeing your LinkedIn, you didn't only work as a health planner, but you also worked as a paranormal information coordinator and also a data analyst with one of the healthcare facilities in Ontario. So my question to you is, in terms of, I guess, the job requirements or the job duties that you performed in these roles, did your master's degree in epidemiology or your experience as a research analyst, because I know three of these positions, there might have seemed to be a lot of data collection, a lot of research analysis that would need to be conducted in these positions. So did your master's degree in epidemiology or your research assistant position prepare you in any way for these three positions? And if so, how?
Yes. So those positions were all incredibly short contract positions that I was very honored to get. So in my master's, I was actually able to do a practicum at the health unit that hired me on to be the research assistant, panorama information coordinator, and then the health planner. So that was not the health planner job, but the other pieces were actually simultaneous. As I was doing my master's, I also did that. So it was a good learning experience for me because I was doing my master's in epidemiology and using a lot of SAS coding pieces, which I will be happy to never see again in my life. If I'm being completely frank and honest. And for those high schoolers watching, maybe this will be your thing. So please don't take my word for it. It just wasn't mine.
Yeah, never living yourself, like you just said.
Yeah. But Panorama was basically a system that tracks the vaccinations of virtually anybody that came into the public health unit that I was working at the time. And that was helpful in learning how to generate reports, why the data was important. It gave me practical experience as to why do these systems matter, other than being able to track and for me to be able to see when my last vaccination was. Why does it need to spit out what it needs to spit out? And I'm thinking now, obviously not that I'm there anymore, but with the COVID-19 pandemic, it would be even more so with the vaccinations coming out there. So it was definitely helpful to have that simultaneous, okay, this is the reason why data is so important, because it really does drive programming and policy and all those kind of things.
Yeah, that's great.
Yeah, we are using Panorama in Nova Scotia Health. That's where I am. I don't know if you know that.
That's awesome.
Yeah. So I'm not the one who's working on it, but like I have colleagues who are working on it. So they were very busy. And even right now, what the point you mentioned about vaccination. So yeah, they're on it. I cannot say much more than that, but yeah, they're on it.
Yeah.
The other question I had, Danielle, for you is, I know that. So was your master's thesis based or was it practicum?
So my master's was thesis based, so I did have to produce a thesis, but my practicum was not. So I should back up a step. I did my master's of science in public health and health systems, which is a lot different than an MPH. So with mine, I did a thesis based, but as one of my courses, I substituted a practicum. So my practicum would have been a lot shorter than someone who had done an MPH. But that's how I got the practicum experience, which I would have never traded for the world. If you have the opportunity to have a practicum in any capacity, it might be more time for sure than a normal course would be, but I would highly recommend doing it.
Yeah, that was actually going to be my next question to you, was for any undergrad students who are trying to pursue masters, in public health or epidemiology. Yeah, so you just answered my question. So the question that I was going to ask was, would you recommend thesis based or would you recommend practicum? But you just said it would be practicum, right?
So,
yeah.
Sorry, I should clarify. So I would say thesis based, but if you have the option to do a practicum, do a practicum within it if you can. The reason I say that is because a thesis gives you a different appreciation and a different depth of understanding of certain work. And a practicum gives you the practical experience that you can. So if you can find a program with both, that's ideal.
Yeah.
That would be my, sorry, that
No
would be my suggestion.
No, you answered my question, so yeah, that's great.
So I guess another thing that I would like to know is when it comes to these different jobs, and then everyone has different priorities in life at different stages. What about the workload? As in, like, maybe if someone wants to look forward to maybe only some people just want to work 40 hours a week, and that's good. Some people really want to work a lot, and some people want to work on new projects every third week. That's me. I haven't got that opportunity. That's why we're doing this. So what does that look like for you? And did that match your expectations, what you were looking forward to, as in like how it would fit in with your life? Because there are other aspects to life as well other than work. So just curious what your perspective is on that.
Absolutely. So I should preface this by like, I'm super type A personality and like to be very organized in everything that I do. So I need for myself clean breaks. So for instance, I have to set very strong limits because I would be the type of person that would check my email like into 11 o'clock at night or something for work.
That's
And
me too.
so for me, I really need to set hard limits. So usually what I've been doing during this kind of work from home period is I treat my commuting time as part of my work time. So I will give back whatever my commuting time would have been normally to my work. So I get to work that extra hour and a half because I would usually commute 45 minutes to and from work. So not only does my workplace benefit, but also I get more work done. And also it was the same amount of time that I would have spent at work commuting there and back anyway. So it's kind of a win-win-win. But I really believe in work-life balance because and I've actually had the pleasure of working for managers actually in every job that I've had that have actually like kind of sanctioned me, because in the first 2 weeks, I'm always like, nope, I'm working 7 o'clock, 8 o'clock at night. And I've had managers that have been like, do not answer this email ever again, like very strongly. Yeah. So once I get that kind of first email that it's like, no, it's okay, don't do this, I typically don't. But I am the person that works through my lunch. I am the person that, starts my day half hour early. I am that person. But when I'm done, I know that I need to shut it off. So I would, as hard as that is.
Okay. Yeah. So, but like, what about the number? If you want to put a number at it, like what's in your current roles that you've had over the past, like what do you think, how many hours you need to put into it? Not necessarily how many hours you have put into it earlier, because maybe now in hindsight, you might think you could have been more efficient, less stressed about it, or, less type A, if if I can say that.
I would say normally it's a 40-hour work week that I would suggest. Do I put in more hours? For sure. Probably about 50, realistically. But I will say there's a couple of times, like for instance, when there's in between Christmas and New Year's, for instance, I probably only work 40 hours because if I don't take it off on vacation like I did this year, but because there's less people working, there's no point in just working extra for working extra. But when I was very much in the depths of an EMR transition earlier in the fall / end of the summer this year, I was probably putting in 65 hours a week because that was when the project was at its height and people needed me. I needed to be on and I needed to be there. So if there's a project, it will flux. And actually, that's kind of the nature of my role is with different projects. They'll hit high times at different points of the year or month. And so you have to put in the more time there. So it fluxes for sure.
Right. And what about the roles that you've had before? Was it similar or was it different?
I would say it's probably very similar. Like I had when I was working at Vancouver General Hospital, like if there's a there was a couple of times, I'm just thinking about like project-wise, that there was, I hosted a Vision Zero, which is a road safety initiative grant program symposium. And so I put in an incredible amount of hours prior to that, prepping for the symposium, getting speakers in, all these kinds of things. So again, it fluxed. But generally, I would say probably around the 40, 45 hours a week mark. So that probably was maybe a little bit less, but it was also in a setting that was very structured. So it was a little bit different. The health planner role, again, that position was unionized. So again, more structured, and probably around the 40, 45 hours a week mark there, because that's, again, just a little more structured in that way. But again, more if the project is coming to a height, you got to put in those extra hours.
All right. Mir?
Yeah, so Danielle, just to ask you one other question. So I know that you briefly talked about working in Vancouver, and prior to Vancouver, you were in Ontario. So I know in this interview, earlier you mentioned that don't limit yourself to anything. So my question based on that is, I mean, you transitioned from Ontario to Vancouver, and you know, it was a risk. Like a lot of people don't tend to take that risk in terms of their careers. So my question to you is, well, number one, did you find the opportunities in Vancouver for what you were looking for in terms of your career goals? Did you find that there were an abundance of opportunities compared to Ontario? And number two, what advice would you give to an undergrad or to a high school individuals who are, you know, looking to transition to a different province to attain their career goals or attain their career work experiences?
Okay, so those are both really good questions. So kind of to set the stage a little bit. So my health planner role, I absolutely loved in Ontario. I never probably would have left that position if it would have been permanent full-time, but it was a contract. So it was coming to an end. And so I knew I needed to start to look. And I'd been given some advice previously that had kind of stuck with me a little bit. And this person had said, try to get experience in a variety of fields within your main field of focus as early as you can, so that you can understand what you like and what you don't. And so for me, that biggest scope was health. And so there was kind of three main aspects, or actually probably four, within healthcare that I wanted to get my hands kind of dirty in. So in high school and university in the summers, I worked in long-term care in administration. I then just, at that time, before I started to apply to jobs after the health planner position, I had been in public health in a couple different roles, just for short-term contracts again. And so I thought, okay, the only places that I could see myself going other than that was community health or acute care. And so I kind of started to look in those areas, but also kept looking in public health because I still really enjoy public health. And this position came up as the injury prevention lead at Vancouver General. And it was on LinkedIn that I saw it. And I thought, okay, first off, like, I'm a pretty fresh in my career. I'm never going to get this position. Let's apply just for kicks. And I'd done some injury prevention work in my health planner role in falls prevention, as I mentioned earlier. And I had also been a hospital volunteer and such. And I thought, you know what, this is really cool job. And I get to work with trauma surgeons. I wanted to be a surgeon in high school. This is just this is the job. I'm never going to get it, but I'll apply. So I applied and I got the interview and I thought, okay, well, I got the interview, but there's and never turn down an opportunity for an interview. That's something I would say to students out there. Like, even if you think, you know what, maybe this isn't even the job for me, it's great experience. So go through the process of the interview, and sometimes you'll learn something a bit different about the position that you didn't know. But I did the interview, and I offered to fly out for the interview, but they just did it on Skype. And this was pre-COVID, so this was like very, like when I told my friends and stuff, they were like, that's so like, you know, modern and stuff like that. So I did the interview, and I got a call that I got the job. And I was like, oh my gosh, what did I do? Like, I'm going to be like, all the way across the country from my family and friends. I was recently engaged at the time, and my husband to be at the time, who is now my husband, was actually the one who had said, I'd be interested in getting a job in another province. Like, would you ever look? And that's what kind of spurred me to be a little bit more open in my job search. And so he was probably more excited about it being in Vancouver than me. But I was like, okay, Vancouver's beautiful. This is awesome. I'm going to take this opportunity. I'm going to jump and go. I'm very much a planner. So you have to know me that when I got the interview, I was already looking at housing. I was already looking at a bunch of different things. When I could fly back, how I was going to organize a wedding at that point, all these different things. So when I took that jump to Vancouver, it was scary, but it was the best thing I could have done. It showed me a couple of different things. One, never stop yourself from applying to a position that you think you might be slightly not qualified for. And the reason I say that is because I've seen so many of my friends not apply to positions that they thought, I'm never going to get that. I'm not even going to apply. Just apply, because you never know. It showed me that I really enjoyed acute care, and I really enjoyed the policy work that I was doing in Vancouver. The only thing that I didn't like was that I was a sole team of one. So being in a trauma center, being surrounded by surgeons and nurses and team members that were fabulous, I was the liaison essentially in that role between the trauma department and the public health unit. And I loved my trauma team, and I loved what I did with them. And I loved the public health system in Vancouver. They were awesome people too. But it was very difficult to navigate a scope of work that didn't cross over into somebody else's role. And so it was limiting in that way. Like, you could only do so much because you were in that kind of main focused role. So I think it needed to iterate a little bit, but it was an amazing experience. And I would go back to acute care. I enjoyed it, but maybe in a different capacity. And then I really enjoyed coming back to Ontario and finding something else new in community. So in community health. So now I've actually been able to dabble in each of those different areas, and I know what I like and what I don't kind of in each of them and what uniqueness they bring. But highlights of Vancouver definitely would be taking that step, making that whole independent focus, which probably gave me the confidence to do other positions that I've done. And also, for anybody who's thinking about doing it out of province, do your research. So I know it'll sound like enticing, like, oh, I could go to Calgary, or I could go to here, or I could go to Vancouver, or I could go to Kelowna. And it's super exciting, but don't just do it because you think it's a different place that I get to go and explore. You do. Don't get me wrong. I got to see a lot of really cool places when I was out there. You know, I was probably up at Whistler like every month. But the thing is that it's more than just a place. You have to see it fitting into your career in some way and how it matches your lifestyle. That's another thing. Like, I knew I wouldn't be happy if I was in a place that I wasn't happy in. So just consider all those things. But it's an awesome opportunity, and I would highly recommend everyone do it at least once in their life. But just choose the place wisely. Highly recommend Vancouver.
Yeah, that's great. Thanks, Danielle, for elaborating. I think the other message that that we can take from your explanations would be, I guess you shouldn't be fearful for whatever opportunities you get, because if you didn't take that Vancouver opportunity or worked with the surgeons or worked as the injury prevention lead, you wouldn't know what you liked or disliked, right? Because you pretty much indicated that I guess that position was limited in terms of the scope or in terms of the responsibilities. So you learned from that and you decided to I guess um, find another goal or find another area where you wanted to pursue based on that Vancouver General Hospital experience. So that's great.
Absolutely.
Yeah. I think we're pretty close to the time limit that we had. Is there any parting comments, or Mir, if you have any other question that you want to end with, are there any parting comments that you guys want to make?
Yeah, just the other question, Danielle, since we're narrowing down to the end of this podcast interview, is so what's next for Danielle Rawls in the next 5 years? Are you going to be in the quality improvement slash knowledge management facilitator role, or are you in healthcare, or are you looking to expand your role or your skills?
I think there's always a place for expanding and growing. I would definitely want to move to more of that quality improvement, knowledge translation, program planning area. I love that. I know that I like it. I've had a couple different positions where I've been able to do a little bit of all of them. And so that's really where I want to focus my time and energy, because I feel like I make a difference in those kinds of roles. And it's what invigorates me. In the next few months, I'm improving my Lean Six Sigma. So for a lot of those folks who aren't sure what that is, so quality improvement has kind of levels. And so I'm going to the next level of that training. And I'm very grateful to my team who's supporting me in that at SCHC. So always growing in that way. And always looking for opportunities for future development, but that's definitely my focus area that I want to be in. I don't want to sacrifice at this point in my career what I love to do. And something that I've said in interviews before is I don't want to sacrifice passion. And passion is something that will always move you forward. So if you're passionate about what you do and you like what you're doing, there's always going to be about that 10-15% of your job that you're like, no, I don't want to have to do that. But that's normal. That's a normal part of every job. But if you have that 75% or that 50% or whatever it is that really makes you passionate about what you do, that'll drive you forward. So that's what I would say.
So great.
That's great.
Okay, well, thank you so much for your time, Danielle and Mir.
Yeah,
thank
you so much, Danielle, for your time. And like I mentioned to you earlier, Danielle, we will be posting your LinkedIn profile with this podcast recording on our YouTube channel. So for anyone who's watching, if you're interested in reaching out to Danielle for any additional questions, not only about her work experiences, but if you had any questions in terms of quality improvement or any other experiences Danielle was part of in her previous previous work experiences, either feel free to reach out to us or to her as well. But nonetheless, Danielle, thank you so much, and I hope you have a wonderful night.
Thank you. You both as well.
Take care. Bye.
Bye.